In this video, we're going to talk about pooping. I, as a pediatrician, even when I was in medical school and even when I was in residency, never thought that I would be talking about pooping as much as I do in practice. I mean, every day, like a million times per day, all we do is talk about poop. With kids, with parents, with teenagers, with infants, like, it's all poop. That's okay. I feel like I have a good handle on how to help with pooping problems now, more so than I ever thought I would. And I never thought that I would say poop as much as I do. I get people that leave diapers on the table for me to look at, like they bring them in. I see pictures of poop that parents take a picture of it and want me to look at it all the time. And I do. Um, and pooping is a big deal. So here's a pooping question for you. Actually, it's for me. It's for my text messages. And if you have a question, you can text me. It's 402 256 0768. Text me, and I will do my best to answer your question as quickly as possible. Now, here's a question. My daughter turned 3 at the end of September, and on Monday she decided she was done with diapers. She's been going in the potty occasionally over the past few months, but we took a no pressure approach, which is what I like and what I teach people, and it works really well. They might be in diapers a little bit longer, but it's very low stress, stress free. Potty training is my preferred. This was all okay, but let's see. This was all her idea, and she has done great, except she hasn't pooped since Monday, and her stool was nice and soft then. I'm obviously going to call her pediatrician in the morning if we don't get one overnight, but do you have any tips, advice? She doesn't seem afraid of it, doesn't appear to be consciously holding it, and has tried to go and then says she doesn't need to. Thank you. Okay, parents want to know how often pooping is normal, and throughout life, throughout childhood, I get very unexcited with how long it goes between pooping. Babies will poop every time you feed them. Babies will poop every 3 or 4 days. Both are normal. Toddlers will poop twice a day. Toddlers will poop every 4 or 5 days. Both are normal. I care much less about the frequency of pooping than I do about how difficult it is to poop. And really, the only time that I find that there's much to do about poop, one is if they have like a viral illness and they have diarrhea and we need to make sure they're hydrated. But more often than not, I'm talking about constipation. And I'm just finishing on my clinical today. And we saw probably 20 patients and probably talked about constipation with at least 4 or 5 of them and came up with a plan because it is that common. It's a mixture of toddler diets and not drinking as much water and a lot of dairy for a lot of kids and not a lot of roughage and American diet and all those different things that play a role. And a lot of kids are just kind of on the constipated side. So the way that I look at it is if they're pooping infrequently, it's hard, and they have to push or they're in pain, then that's a problem worth addressing. If it's just a frequency thing, then I don't ever worry about it. And parents would say, well, how many days before we need to come in and, do something about it? And I don't have an upper number where I say you got to come in. If baby's comfortable, if toddler's comfortable, if baby or toddler is eating fine, acting normal, they will poop. That's just the bottom line, is that they will eventually poop. So I try not to worry about the number of days or anything like that. If it's more difficult for them to poop, then we talk about different strategies. Increasing water, fruits and vegetables, those things kind of work to some degree. Oftentimes the first thing that I turn to is a little bit of juice. And that's actually a recommendation from the NASPGHAN, which is the North American Society for Pediatric Gastroenterology, Hepatology, and Nutrition, which I cannot believe that I knew that whole acronym, NASPGHAN. But that's what they recommend as first line, and that's what I tell parents too. In general, we don't need juice. In general, juice is just like chocolate cake, like not something that's needed every day. You can do it at birthday parties and after soccer games if you want, but on a regular basis, you don't need to have juice. But it does help to draw more water, to move things along so that we poop more frequently. And so pretty much regardless of the age, if baby is having trouble pooping, that's my first go-to step. If they're breastfed, then I try and talk parents into using a bottle from time to time and mixing in some juice. But otherwise, juice is kind of my first line thing for constipation. Apple juice, pear juice, prune juice, it really doesn't matter. Just something, a couple ounces, once a day, twice a day, until you get the desired result, and you will get the desired result. And so this question is more about the potty training aspect of poop. And in general, I think that in general, I recommend that people have frequent opportunities to try and go poop. And that's the best way to get toddlers to poop on the potty, especially if they're not constipated. They just don't want to poop. That's totally fine. I just put them on the potty from time to time. Give them a book to read. Give them a iPad if you have to. I think those things are fine if it encourages to sit on the potty and try and go poop. Holding a kid on a potty to try and go poop, you will never get them to poop because you do have to be like relaxed and in the mood to poop. And holding a kid and telling them to poop is the worst way to try and get them to poop on the potty. It causes trauma. It causes them to not want to poop on the potty because not only does it hurt, it's scary. I don't like this. It's not comfortable to me. So pooping on the potty, peeing on the potty, totally separate animals. I just say opportunity is the best way to get them to poop on the potty, and then some sort of reward. It can be an M&M or an Oreo or a sticker or a truck or car or whatever you think for going poop on the potty. Perfectly fine, perfectly acceptable. Just give them ample opportunity to try. If you schedule it around when they usually poop, like parents usually know they poop after lunch or they poop after dinner or they poop after breakfast, they always go and hide or something like that, then that's when I tell them that's the best time to have them go try and poop on the potty, is around that time. Just have them sit there. Sometimes they'll have success, sometimes they won't. It's all good. I hope that was helpful. I hope that took away some of the anxiety that goes along with pooping. If it was, would you hit the like button? I try and make videos that answer parents' questions, and if you hit the like button, that tells me that this video was helpful and it gave you some peace of mind, some reassurance, some actionable information. And if you have a question, I would love to answer it. I love answering these questions. This is a really fun medium for me to share, and the best way to do it is just text me, 402-256-0768, and I will answer your question as quickly as I can. And if this has been helpful and you know somebody else that's struggling, would you hit the share button? There's a share button right down there. And that will help other parents to see this information too. In the meantime, keep up the good work. Oh, and also I have a potty training course. If you click the link below, you can do it. It's quick, it's effective, it's no pressure. It works great. I hear from parents all the time that it took the guesswork out of them for it. So if you'd like to do my potty training course, just click the button below and you can join in. Keep up the good work. Thanks for watching. Now, before you go, hit subscribe. And if you have a question, text me, 402-256-0768. Keep up the good work.